Good evening, and thank you for joining us for day 3 of the special virtual education series from the National Lipid Association, Lipid PALOOZA, offered in celebration of National Cholesterol Education Month. My name is Wahida Karmally, and I'm a special research scientist at Columbia University in New York City. I would like to thank the National Lipid Association for inviting me to speak, Amrit Farmer for sponsoring this session, and to Amina Rashidat, a director at the FNLA, for her fantastic support. I am joined today by fellow dietitian Emily Malorzo from our sponsor, Amrit Farmer. We are pleased to present tonight very low saturated and trans fat diet in a healthy eating pattern for homozygous familial hypercholesterolemia. If you have any questions for us during the session, please submit them through the Q&A section on the right-hand side of your screen. We will address as many as we can at the end of the presentation. Before we get started, we have one brief polling question on the screen. Please respond now. I will begin the session with a 20-minute presentation on nutrition strategies to lower LDL cholesterol in patients with homozygous FH. I think this is a good time to address healthy eating when you're about to either plan or prepare your next meal. These are my disclosures, and I will review evidence-based recommendations, discuss nutrition strategies to lower LDL cholesterol, and review eating patterns to improve lipid levels. Homozygous familial hypercholesterolemia is a rare, life-threatening condition characterized by markedly elevated circulating levels of low-density lipoprotein cholesterol and accelerated premature atherosclerotic cardiovascular disease. Early diagnosis of homozygous FH and prompt initiation of diet and lipid-lowering therapy are critical. The frequency of clinical homozygous FH has been estimated at 1 in 1 million, higher in specific populations such as the French Canadians, Afrikaners in South Africa, or Christian Lebanese have been reported due to founder effects. So in the circulation, the AHA ACC clinical practice guidelines have looked at the class of recommendation, which means the strength of recommendation, presented in the as green, the yellow being moderate class of recommendation, and the red is also strong recommendation, class of recommendation. And what this shows is the level of evidence is at the level B level, and it includes randomized trials as well as non-randomized trials. So a diet emphasizing intake of vegetables, fruits, legumes, nuts, whole grains, and fish is recommended to decrease atherosclerotic cardiovascular disease risk factors, and replacement of saturated fat with dietary monounsaturated and polyunsaturated fats can be beneficial as well to reduce risk factors. A diet containing reduced amount of cholesterol and sodium can be beneficial to decrease atherosclerotic cardiovascular disease risk. And as a part of a healthy diet, it is reasonable to minimize the intake of processed meats, refined carbohydrates, and sweetened beverages to reduce the risk. It's also important to to minimize the intake of trans fatty acids. In fact, they should be avoided to reduce the risk. Among the top 10 take-home messages to reduce risk of atherosclerotic cardiovascular disease through cholesterol management, the top one is in all individuals, emphasize a heart-healthy lifestyle across the life course. In younger individuals, healthy lifestyle can reduce development of risk factors and is a foundation of risk reduction. In young adults, 20 to 39 years of age, an assessment of lifetime risk facilitates the clinician-patient risk discussion and emphasizes intensive lifestyle efforts. In all age groups, lifestyle therapy is a primary intervention for metabolic syndrome. In the European Heart Journal, homozygous familial hypercholesterolemia has provided new insights and guidance for clinicians to improve detection and clinical management. So for the diet, what's recommended is a low saturated fat, low cholesterol, heart-healthy diet for all patients. And patients should be encouraged to be active after they get clearance from their physicians. And other risk factors such as smoking, hypertension, and diabetes should be aggressively targeted. A review of more than 3 decades of progress in providing clinicians and patients with guidance on risk assessment, patient evaluation, and cholesterol management states, it is always judicious to recommend lifestyle intervention where benefit is appreciable and risks are low. All major guidelines recommend healthy lifestyle as a foundation for preventive efforts over the lifespan. Lifestyle benefits are not limited to cholesterol lowering alone, but extend to multiple atherosclerotic cardiovascular disease risk factors. So the nutrition therapy for lipid disorders, in order to help achieve a lipid and lipoprotein profile that reduces the risk for vascular disease, should emphasize and maintain the pleasure of eating by using herbs, spices, and at the same time, reducing saturated fats, minimizing intake of trans fats, lowering cholesterol intake, using unsaturated fats such as oils and unsalted nuts, consuming foods containing viscous fiber, also known as soluble fiber, and adding stenol sterol esters, and recommend weight management strategies if indicated for weight loss. So the dietary guidelines 2015 and 2020 also emphasize a healthy eating pattern with vegetables and fruits, lean proteins, low-fat, non-fat dairy, using whole grains and unsaturated oils. And the healthy eating pattern should be very low in saturated fat, added sugars as well. So in order to build healthy eating patterns, we do have research on the DASH diet, the dietary approaches to stop hypertension, as well as the Mediterranean eating patterns. And there's some evidence for vegetarian diets. And the USDA food patterns are also similar to the other healthful eating patterns identified in the research. So here are the 3 healthy eating patterns, and all of them emphasize vegetables of different colors, fruits, whole grains, low-fat, non-fat dairy, lean protein foods that includes legumes, and seafood, also very lean meats, lean poultry, and unsaturated oils. And there are some calories that are left for other uses in order to indulge in some other foods that people enjoy. The National Lipid Association also provided guidelines in 2015, and the guidelines support a cardioprotective eating pattern for the management of dyslipidemia and includes less than 7% of energy from saturated fat. What this translates to is in a 2,000 calorie diet, it's about 15 grams of saturated fat a person can consume. And of course, if they're on lower calorie lower calorie intake, they can't even have as much as 15 grams of saturated fat. Also, the recommendation includes minimal intake of trans fatty acids and limits cholesterol to less than 200 milligrams per day. One large egg yolk has 186 milligrams of cholesterol. So, which means if a person includes one large egg yolk per day, there's very little room for other animal foods. So plant sterols and sterols are also recommended for cholesterol lowering, 2 to 2.5 grams per day, as well as the viscous fibers, 5 to 10 grams per day. These are adjuncts to other lifestyle changes. And plant proteins like soy proteins, also a protein from nuts and legumes can be a good substitute for protein foods that are high in saturated fat and can be recommended as part of a heart-healthy diet. The International Atherosclerosis Society also has global recommendations, and they are as the same as the ones proposed by the National Lipid Association. So let's look at some of the fats that we consume in our diets. The red bars indicate the saturated fat content in that particular fat, and the blue and the green. The blue is the linoleic acid. The green is also a polyunsaturated fat, but it's the alpha linolenic acid. And the purple is the marine source of the omega-3s, which is the eicosapentaenoic and docosahexaenoic acid. And the yellow bars are the monounsaturated fat, the omega-9, like the oleic acid. So there's a lot of, incorrect information on the internet promoting coconut oil with health benefits for many diseases. But if you look at this slide, over 90% of the fat in coconut oil is saturated. And it has been shown in many studies that it raises LDL cholesterol. So in a meta-analysis of 16 trials, coconut oil consumption was significantly increased low-density lipoprotein cholesterol as compared to non-tropical vegetable oils. And although coconut oil consumption also increased high-density lipoprotein, all fats raise high-density lipoprotein cholesterol, but efforts to reduce cardiovascular disease risk by increasing HDL cholesterol have been unsuccessful. And there's no evidence of benefits of coconut oil over non-tropical vegetable oils for adiposity or glycemic or inflammatory markers. So if you look, this slide shows that lauric acid is even more potent than myristic and palmitic acids, which are all saturated fatty acids. And coconut oil's lauric acid content is 45%, is very high in lauric acid. And coconut oil, as you probably know, is promoted as a medium chain fat, which is also incorrect because lauric acid metabolically behaves like a long chain fatty acid and does raise LDL cholesterol. So saturated fatty acids have a significant effect on cardiovascular disease health. They increase total and LDL cholesterol, increase coagulation, increase inflammation, increase adiposity, increase insulin resistance, and increase risk for cardiovascular disease and type 2 diabetes. So the Cochrane database has also provided a systematic review, and it states the greater reduction in saturated fat cause greater reductions in cardiovascular events. So because trans fat is not permitted in our food supply. Manufacturers are looking for different ways of making spreads. And one of this slide has a picture of a label which shows the ingredients are butter, which has 64% saturated fat, and it has also the oil from produce. That's a very clever way of making it sound very exotic. But if you look at the nutrition facts label, 1 tablespoon has 11 grams of total fat and 5 grams of saturated fat. This is like spreading a tablespoon of this spread is equivalent to having putting beef fat on your toast. Beef fat being 46% saturated fat. So here's another meta-analysis on dietary cholesterol, which is again, very confusing to patients because they keep hearing it's okay to have as much cholesterol as you want. And there are, of course, we have the American Heart, the National Lipid Association, which give recommendations on lowering cholesterol intake for patients. So dietary cholesterol significantly increases in these studies, increase both serum total cholesterol as well as LDL cholesterol. These were 40 studies, 17 cohorts, and there were several thousand patients that were looked at. So another recent study showed that among US adults, higher consumption of dietary cholesterol eggs was significantly associated with higher risk of incident cardiovascular disease and all-cause mortality in a dose-response manner. And this analysis included almost 30,000 participants with a mean age of 52 years. And the authors concluded that these results should be considered in the development of dietary guidelines and updates. And Dr. Eckel wrote for this paper, and he stated that compared with meta-analysis and reviews previously published, this report is far more comprehensive with enough data to make a strong statement that eggs and overall dietary cholesterol intake remain important in affecting the risk of CVD and more so the risk of all-cause mortality. This was the editorial provided by Dr. Eckel. The AHA Science Advisory on Dietary Cholesterol and Cardiovascular Disease states the dietary guidance should focus on healthy eating patterns like the Mediterranean style and the DASH eating style, which is the dietary approaches to stop hypertension. And these diets are inherently relatively low in cholesterol because they emphasize more vegetables and fruits and nuts. And patients with dyslipidemia, particularly those with diabetes mellitus or at risk for heart failure, should be cautious in consuming foods rich in cholesterol. There are recommendations for dietary cholesterol from different countries. And as you can see on the slide, it's either less than 200 milligrams per day or less than 300 milligrams per day. So the current intake, which is from NHANES 2013-2014, we are consuming approximately 300 milligrams per day as an average for both males and females. There's a systematic review from the Cochrane database on omega-3 fatty acids for primary and secondary prevention of cardiovascular disease. So the long-chain omega-3 fatty acids, including the eicosapentaenoic and docosahexaenoic, as well as from plant sources, the alpha-linolenic acid, which is an essential fatty acid, they slightly reduce risk for coronary heart disease, mortality, and events, and reduces serum triglycerides. This is evidence mainly from supplement trials, and increasing ALA slightly reduces the risk of cardiovascular events and arrhythmias. So the marine fatty acids have been also written up in the Proceedings of the Nutrition Society, which is published this year. And it stated, while it seems appropriate to recommend consumption of fish, particularly fatty fish, for prevention of cardiovascular disease, and effect of fish supplements is probably at best marginal, perhaps apart from patients with hypertriglyceridemia. So here's a chart to show you how you can incorporate soluble fiber, viscous fiber in your diet, because this can be very helpful as well to lower LDL cholesterol. And if you look at the different components of the interventions, saturated fat less than 7% can give an approximate LDL reduction of 8 to 10%. Dietary cholesterol less than 200 will give you a reduction of 3 to 5%. Dietary cholesterol in patients that even we've studied, we've seen some are hyper responders and some are hypo responders. Weight reduction, a loss of 10 pounds, another 5 to 8%. Viscous fiber, 3 to 5%, and plant stenol esters, 6 to 15%. And even if a person is on a medication, these dietary interventions can give you a further reduction in LDL cholesterol. So if a patient is being recommended or allowed to have alcohol, it's very important to give the size of the drink. If you say that you can have one drink a day, it's really like 5 ounces of wine or 1.5 ounces of scotch or 12 ounces of beer. I've actually had a patient who told me his doctor said that he can have 2 drinks, and his translation was 2 bottles of wine. So you can, when you have all these recommendations, it's important to individualize guidelines, and they may require modification with food choices that patient enjoys, or it could be due to their cultural eating habits. To manage other risk factors as well, if they have diabetes, hypertension, they have food allergies, any intolerance, or any drug nutrient interactions, which may require change in the composition of macronutrients as well. So sound bites that can be confusing to a patient will be when you say cut meat or cut fat or no red meat, or go exercise or increase soluble fiber or lose weight. They really don't know what that means and how if they're not made if their recommendations are not actionable. So I had a patient who was told don't eat red meat, and when I asked him about what he was eating, he said he was eating half a chicken basted in butter. So for effective lifestyle counseling, patients' motivation to change is essential. Goals must be clear, outcomes must be measurable, methods must be practical, and interventions must be culturally compatible. Here are a couple more resources, and thank you so much for your attention. We are now excited to present a virtual low-fat cooking demonstration sponsored by Amrit Pharma. Please note that the recipes that are being used are available as downloads in the handout section of your screen. And before we get started, we have one more brief polling question on the screen. Please respond now. Thank you for your responses. We will begin with a brief message from Amrit Pharma.
Thank you for participating in today's event sponsored by Amrit Pharma. The following information is provided as a courtesy by Amrit Pharmaceuticals. It is intended as general information for HoFH patients currently taking an Amrit product and is not intended to replace any advice you may provide to your patients regarding dietary restrictions or limitations specific to their individual situation. Please be aware that recipes or suggested flavor enhancers, spices, etc. may contain ingredients that are known allergens to certain individuals. As always, patients should consult with their physician prior to starting a new dietary program.
Hi, I'm Juliette O'Connor, and I'm a clinical educator and registered dietitian with Amrit Pharma. Our team works with patients who have been diagnosed with homozygous familial hypercholesterolemia, or HoFH, and who have also been prescribed an AMRIT product for the treatment of HoFH. It is recommended that these patients follow a low-fat eating plan where only 20% of their calories are coming from fat, and this is in order to minimize potential gastrointestinal side effects. This recommended eating plan is lower in fat than a traditional heart-healthy diet and can be challenging for some patients to follow. So as a result, our team has developed many recipes and supporting materials to help these patients while they are on treatment. We want to make it clear that this eating plan is not for all patients diagnosed with HoFH, just the ones that are currently prescribed an AMRIT product. And in addition, you should always adhere to your physician's advice regarding any eating plan or dietary restrictions. So today, I'm going to share a recipe for fried chicken salad with a homemade ranch dressing that was inspired by one of our patients. So who doesn't love fried chicken, right? But can you eat fried chicken on a low-fat eating plan? I'm going to show you how you can today. You just need to think a little bit outside the box and learn how to modify these recipes. So today we are going to actually air fry some chicken. Air fryers have become more popular in the recent years, where they still give you that crispy texture you're looking for in deep fried foods, but without all the added fat. If you don't have an air fryer, you can still achieve this effect by cooking foods in your oven at really high temperature, like 400 or 425 degrees. So here we have a boneless, skinless chicken breast that has been marinating in buttermilk. And now, despite the word butter in its name, buttermilk comes in both a low-fat and a fat-free version. So this is fat-free buttermilk here. And it's used because it adds flavor, but it's also slightly acidic, which helps to tenderize the chicken. So you'll want to marinate this chicken for at least an hour, but preferably overnight. So after marinating the chicken, you're going to take it and you're going to dredge it in the flour and the seasonings that I've already put together. Now I've started this process already, as you can see, just to keep things moving. Looking for in deep fried foods, but without all the added fat. So I've added the chicken to the air fryer, and I'm now going to go ahead and spray the chicken with a little cooking spray. And this, when you spray it with the cooking spray, it's going to give the chicken that nice golden brown color that we're looking for with our fried foods. So you want to cook this chicken for about 15 or 20 minutes, really depending on the thickness of the chicken, but until the internal temperature reaches 165 degrees. Okay. So while that's cooking, let's talk a little bit more about this low-fat eating plan. What about other foods that you may want to eat that are high in fat? For example, I love peanut butter, but I know it contains high amounts of heart-healthy fat, which may be too high in fat for this low-fat eating plan. And then are there any good chocolate products maybe that I could try when I want something sweet? What about cheese? Can I ever have cheese again? I'm going to turn it over now to my colleague Karen, so she can answer these questions.
Great question, Juliet. It's more important than ever to keep easy, low-fat foods and snacks handy around your house, in your pantry, so that when you are craving something salty or craving something sweet, you have healthier options to grab. I have a few ideas for you today that I'm going to show you. First, you mentioned peanut butter. 2 tablespoons of peanut butter can have 16 grams of fat and 3.5 grams of saturated fat. So that can add up so quickly. One of the products that I like to keep around is this powdered peanut butter. 2 tablespoons only has 1.5 grams of fat and 0 grams of saturated fat. You can mix this with water and use it on celery or on a sandwich, or you can take the powder and put it straight into your smoothie in the morning. So you're adding protein without adding the extra fat. Next, you mentioned cheese. Cheese definitely needs to be limited because cheese does have a whole lot of fat. But there are a couple options that you can have that are gonna help with your portion size, but also the amount of fat. This is a light cheese product that I like to put in lunches and for myself and my children. Only has 3 grams of fat, and I love that it's already portioned out so you know how much to eat. If you're looking for like a spreadable cheese, there's a lot of options out there that are light. This again has a great portion size for you, and it's only 1.5 grams of fat. So these are ones that I like to keep around the house so that if I do want some cheese, I know I have something I can grab that's gonna fit in my low-fat eating plan. Next one I think of snacks in the house. A lot of people will think salty. When you think of salty, what comes up? Chips. Chips are something that can really put you overboard when it comes to your fat intake. So some alternatives that we like to keep around our house are apple chips. These of course have 0 grams of fat, 0 grams of saturated fat. This one even has cinnamon, so it adds a little sweetness to it. Or pretzels. Luckily, there's so many different options of pretzel chips out there now. They have all the flavor you can think of. Most of these are 0 grams of fat, and if they do have some fat, it's maybe 1 gram of fat per serving, so still very low and great to have as a snack. You can even have it with your favorite mustard. So as a snack that you know is gonna be low fat. When I think of sweets, at some point we all crave something sweet. So it's good to have some alternatives in your house so you have something to grab. For chocolate, I really love these dark chocolate peppermint patties. It only has 1 gram of fat, 1/2 gram of saturated fat, and again, it's already portioned out for you, which is really nice. When it's hot outside, if you ever crave ice cream, again, it's nice to have some alternatives available in your house. One of the things that I really love to have is a blood orange sorbet. There's lots of different brands and flavors, but for us, we really like the blood orange. It's 0 grams of fat, 0 grams of saturated fat. There's lemon, there's lime. You can find all different flavors of sorbet these days. Also fruit bars. These are great if you have kids or grandkids coming over because they are made with real fruit. There's no added sugar. And again, 0 grams of fat, 0 grams of saturated fat. Lastly, I have to mention, of course, you always want to have lots of fresh fruits and vegetables handy so that when you are wanting to grab a snack, you have something such as carrots or celery or apples or bananas handy that you can go grab. And before I go, I just want to mention it's always a good idea in your pantry to have an olive oil cooking spray so that when you are preparing food, you can quickly put this in the pan without adding any fat. When I think of low-fat eating plan, sometimes people will ask me, how do you keep your carbohydrate intake down when eating low-fat? Because a lot of the low-fat foods seem to be very high in carb. Deborah, could you maybe share some ideas for low-fat foods that are also going to be low in carbs?
Hi everybody, thank you Karen. Those were some great swap out ideas, and in fact I think I'm going to steal a couple of them for my low fat, low carb snack talk. So like Karen said, a lot of times when we try to eat low fat we end up accidentally eating high carbohydrate just because that's some of the easily accessible foods that are low fat. But it doesn't have to be that way. When it comes to low fat eating, it doesn't have to be all or nothing with carbohydrates. And there's plenty of snacks available that are low fat and low carb, which can help keep your triglycerides and your blood sugar under control. So one of the snack ideas that I'm going to go through today are some that are made with an easy swap out to a low-fat product that is also low in carbohydrate. So one of those options is a fat-free cream cheese. So this is just a cucumber slices with fat-free cream cheese on the top. You can eat it plain like this, or you can spruce it up a few different ways by adding the everything seasoning, make it a little bit taste like you're eating a bagel with cream cheese. You can also, if you're missing sushi, you can add a little pickled ginger or wasabi and soy sauce and have sort of a unwrapped sushi flavor going on like that. You can also add a little ranch seasoning to make it taste a little bit more flavorful. But that's an easy option if you can find fat-free cream cheese, which is not super easy to find these days, but it is out there. So if you do a little Google search, if you're interested, you can find it available. Another option is low-fat cottage cheese. Cottage cheese is very versatile. There's a lot you can do with it. If you can find fat-free cottage cheese, that's great. But even the low-fat version still falls within the 3 grams or less of fat parameters that we're looking for if you stick to a half a cup serving. So one thing you can do with low-fat cottage cheese is add some fresh vegetables and black pepper. So fresh tomatoes, cucumbers, onions, anything that sounds good to you, and just put it in a little bowl with some cottage cheese. If you are wanting something sweet, you can add some fresh fruit or some canned fruit if that's what you have around. Now, a few options with canned fruit. Yes, it does have carbohydrate, but it is natural sugar, which has a little bit better effect on your blood sugar and your triglycerides. And if you get canned fruit in its own juice, you want to rinse and drain the fruit, which will remove quite a bit of the extra sugar, and then you're just left with the sugar that's naturally in the fruit itself. Another option, if you have a sweet tooth, is a sugar-free Jell-O cup, or you can make sugar-free Jell-O out of the box, and 2 tablespoons of a light whipped cream. It doesn't have to be sugar-free or fat-free, just a light whipped cream is low enough in fat and carbohydrate that this can be a very decadent dessert without adding many fat or carbohydrate grams. Now, if you're wanting to eat some foods that are a bit more naturally low in fat and carbohydrate, there's options for you out there as well. So one of those options is a hard-boiled egg. Most of the protein in an egg is in the white, most of the fat is in the yolk. So if you empty out the yolk of a hard-boiled egg and replace it with something like a Dijon mustard, like I have, that adds a lot of flavor without adding fat or carbohydrate, and it gives your food a bit of a kick. Another naturally low-fat, low-carb snack option is just a dill pickle wrapped in deli meat. So this is a deli turkey or chicken would work as well. And that's a fun low-carb, low-fat snack that's naturally that way. Another naturally low-fat, low-carb snack is broth. Broth gets overlooked quite a bit, but it can be quite satisfying, especially if you're wanting to eat more out of the flavor of something than actually being hungry. So heating up some broth and just drinking it out of a mug, or if you want to get a little fancier, you can make an egg drop soup, boil your broth, add a little cornstarch slurry to let it thicken, and then you can drizzle in some egg whites or some egg substitute and have yourself a little egg drop soup as a snack. And another quick and easy one is turkey jerky. So turkey jerky is sold just right next to the beef jerky, but it only has 1 gram of fat per serving, and it's very shelf stable, so you can keep it in your car or in your bag and have an easy snack on the go without breaking your low-fat eating plan. So I hope I've given you some ideas that you can use to stay low-fat and low-carb and stay on your plan. One thing I know that I struggle with is when I'm eating out or eating on the road, or I'm just tired of cooking and I want to get some to-go food, it can be very difficult to eat low-fat at restaurants and eating out. So I'm going to hand it over to my friend Emily, who's an expert on this, and she's going to give us some ideas on how to eat out and still stay on our low-fat eating plan. Emily?
Thanks, Deborah. My name is Emily Malorzo, and I too am a registered dietitian and certified diabetes educator. And I'm here to tell you that it is completely possible to dine out on this low-fat eating plan. Now, it may take a little effort, but it is completely doable if you remember these 4 tips. Number 1, plan ahead. This is so very important. If you know that there's going to be a special occasion, like a birthday or anniversary or a brunch, then it allows you to find which restaurant you're going to, and if it's a chain, look it up on the internet. Most restaurants these days will have their nutrition information with the fat grams available for you to look at so that you can make good choices before you actually get to the restaurant. So, what can you do if it's a smaller restaurant or it's not a chain and there's no nutrition information available? Well, you can do a couple things. 1, you can call ahead and find out if they have any low-fat options on their menu, or you can stop by the restaurant and pick up a to-go menu and look at it beforehand and make choices, so that way when the day comes, you already know what you can order. Another thing that you can do to plan ahead is to keep your Calorie King handy, either the book or the app. Say you're out shopping and you want to stop in for a quick bite and don't have time to plan that far ahead. By using this tool, you can look up certain fast food restaurants, certain other chain restaurants at the tip of your fingers, and maybe be able to pick something out that's low enough in fat that will fit into your plan. The second most important thing you can do when dining out on this low-fat eating plan is to learn how to read the menus. You're going to want to look for key low-fat words such as steamed, poached, grilled, baked, broiled, made to order. All of these indicate that there's not going to necessarily be any added oils or fats used in the preparation. You're going to want to avoid the high-fat keywords such as breaded, crispy, creamy, cheesy, marinated. All of those will indicate that some type of fat or oil has been used. By knowing these keywords, when you look at the menus, it'll make it much easier to decide what to order. The third important thing to do when dining out on this low-fat eating plan is to know what to ask. You may become skilled in reading the menus and learning the lingo, however, sometimes it's really important to dig a little deeper. Just because the menu might say grilled fish and steamed broccoli, you might want to inquire a little bit further and find out, are you putting butter on that fish before it's being grilled or on the broccoli after it's steamed? Sometimes restaurants will do that and you wouldn't know unless you asked. The last thing you want to do is be disappointed once your healthy food gets to the table. Knowing what to ask also means not being afraid to speak up. In a day and age where special diets are common, things like gluten-free, dairy-free, high protein, waiters are used to these special requests and will accommodate. So speak up. Let them know that you have to eat low fat. Request no extra butter or any butter or oil at all in any preparation. Get sauces on the side. That way you can control how much fat may be going into your food. That way you can be sure that you'll be able to stick to the low-fat eating plan when dining out. And the final tip while dining out on this low-fat eating plan is to make smart choices. Flavor foods with fat-free sauces. If there's a chicken sandwich that you want, instead of mayonnaise, ask for barbecue sauce. See if they have salsa to spice up your salad. Maybe try some teriyaki sauce or lemon and lime to flavor your foods. Just because it's fat-free doesn't necessarily mean it has to be flavor-free. So experiment with what they have to offer at the restaurant. Choose a fruit or a salad in place of fries or slaw. Bring your own salad dressing. On the internet, you can find individual packets of fat-free salad dressing that you can carry with you, just in case there's nothing available at the restaurant that's fat-free. And finally, when making smart choices, if you're needing something sweet at the end of your meal, see if they have fruit or sorbet. Or you may just try carrying your own 1 gram of fat peppermint patty in order to take care of that sweet tooth. I hope that these tips have been helpful to show that it is possible to dine out on this low-fat eating plan. Now let's go back to Juliet and see how the cooking demo is going.
Hi again. So let's check out our air-fried chicken. So our air-fried chicken, I've done it in a couple batches, but here's our beautiful golden colored air-fried chicken that we're going to slice up and put on this beautiful salad that I've prepared next to me. All right, so now we're going to go ahead and we're going to prepare the low-fat ranch dressing. So what I've added already to this 4-cup mason jar is some non-fat buttermilk, some fat-free sour cream, and some fat-free Greek yogurt. And to this, we're going to go ahead and we're going to add some dried herbs as well as some fresh chive, some lemon juice, and some Worcestershire sauce. And we're going to close it up. And we're going to shake. And you can see now we have some fresh, creamy, low-fat ranch dressing. And then we'll go ahead and we'll pour that all over our salad. So this ranch dressing has less than 1 gram of fat for 2 tablespoons, and the fried chicken recipe has about 4 grams of fat per serving. So this complete recipe is less than 5 grams of fat, and that's total fat. So also, I should have mentioned too that the herbs and spices is a key strategy when following a low-fat eating plan, because it helps keep meals full of flavor, especially when you're preparing them without as much fat. So we hope you enjoyed this presentation, and we've given you a few tips and solutions for HoFH patients following a low-fat eating plan when prescribed an Amaret product. The recipes I demonstrated will be made available to you. Please stay tuned for our Q&A session that will start immediately following the presentation. Thank you.
Actually, there are no questions. No questions have been posted, but I do have a question. When you're prescribing this low-fat diet to your patients, do you have just a standard amount of fat, or do you determine it as a percentage of the calories they need to consume?
That's a good question. We do individualize it based on the calories that we determine for the particular patient, and then we get 20% of those calories to determine their max daily fat gram. And then based on that, we divide their max daily fat into the amount of meals that they're going to have. So if they eat 3 meals, say they get 30 grams of fat for a day, then we would do 10 grams of fat for breakfast, 10 grams of fat for lunch, and 10 grams of fat for the evening, in order to max out and get the right amount of fat for them for the day.
So when you plan these diets, there are certain essential fatty acids. Do you recommend supplements to your patients for the essential fatty acids, and also to make sure they're getting all the nutrients they need?
Right. So that's a good question too. So based on our prescribing information, what they gave in the clinical studies as well was a supplement of omega-3, 6, and 9, as well as vitamin E, 400 international units. And so that's what is given to the patient in addition to their medication.